Bismillahirrahmanirrahim. To- Today I am going to discuss how to differentiate typical chest pain from atypical chest pain. Chest pain is a common symptom in patient presenting to hospital. Chest pain is clearly a subjective phenomena and may be described by patient in a variety of different ways. A detailed and clear history is key to narrow the differential diagnosis of chest pain. Certain feature of history when combined can be evidence towards or away from ischemic cardiac chest pain. These are the 6 characteristic features on the basis of we can tip the balance of evidence toward or away from ischemic cardiac pain. Typical chest pain is also called ischemic cardiac pain, while atypical chest pain is non-cardiac chest pain. So on the first question, always ask about the exact location of the patient. If does patient give history there is central pain with diffuse and unable to localize the pain, then it is a highly suggestive of typical chest pain. While in the atypical chest pain, it will be the more peripheral and patient will be localized with 1 or 2 finger. Next, ask about the radiations. If there is history of radiation to jaw, neck, shoulder, one or both arms, or very rarely back, then it is suggestive of typical chest pain. While in atypical chest pain, there may be no radiation or maybe atypically radiations. Next is a very important third question is the character of the pain. In typical chest pain, character of the pain will be the tightness, squeezing, choking, tearing, or crushing. While in atypical chest pain, it will be sharp, stabbing, or catching in characters. Next is the precipitation. Typical chest pain is precipitated by exertion or emotions, while atypical chest pain is spontaneously can develop or provoked by posture, respiration, or there may be tenderness and superficial examination of the chest. Next is the relieving factor. Typical chest pain relieved with rest or quickly responds to nitrates, while atypical chest pain not relieved by rest or slow or not response to nitrates. Next is the associated features. And in typical chest pain, there may be the left ventricular dysfunction that can cause the left ventricular dysfunction that can lead to the shortness of breath, and there may be the autonomic symptom of autonomic instability that could be the nausea, vomiting, dizziness, and sweating. While in the atypical chest pain, there may be the multi-system involvement. There may be the symptom of respiratory symptom, GIT symptoms, locomotor musculoskeletal, or psychological symptoms. There is one important thing, that is the duration. Ask about the duration. If patient does give history of short or very long duration, then it is highly unlikely it is ischemic in origin. If patient does give history, there is duration is less than 5 to 10 minutes, it is atypical chest pain. As the typical chest pain has a duration more than 20 to 30 minutes usually. Thank you very much.